like to welcome y'all all today to Steps Through OC. It's a partnership we've got with Clarity Foundation. This is an information session on it. My name is Jill Batch. I'm with Be the Difference Foundation. Like you, I'm an ovarian cancer survivor, or like some of you. Myself and three other women founded Be the Difference Foundation in 2012. We were started by survivors for survivors. And our focus of our mission, the mission of Be the Difference Foundation, is to create awareness and improve the lives of all people affected by ovarian cancer through education, support, and research. Caring for Her is a program that we developed at Be the Difference Foundation that's targeted towards survivors as well as caregivers. And we want to make sure that those people feel supported through their ovarian cancer journey. And to that, we've partnered with Clarity Foundation. They have a program called Steps Through OC, which is Susan Hess will tell you about momentarily. And Clarity is a wonderful organization that we've been proud to partner with for many years. So I'm going to turn it over now to Susan. Thank you.
Thank you, Jill. And thanks to Be the Difference for sponsoring this presentation and for your great outreach work in Texas. I'm the program director of the Steps Through OC program at Clearity. We welcome everyone that's on the webinar today. And please feel free to ask questions through the Q&A box at the bottom right of your Zoom dashboard. We will be answering your questions in our Q&A session at the end. Clearity Foundation strives to improve the survival and quality of life of women with ovarian cancer. We give hope to women with ovarian cancer and their families. We're committed to science, devoted to patients, and we are your trusted partner for the ovarian cancer journey. Clearity is here for life with ovarian cancer. We understand the journey. We've been providing services to the national ovarian cancer community since 2008. We are experts who understand the trauma of diagnosis. We understand the side effects of surgery and treatment. We understand the challenges that can occur with family and friends. We understand that fear of recurrence. We understand that high anxiety and short tempers that can happen. We understand the changes and the sorrows. We understand that threat of mortality, and we understand the science. We walk with you on this path. Clearity has two signature programs. Our OC scientific support team offers individualized scientific information about approaches to treatment and clinical trials, and it's been the program since 2008. And the Steps Through OC program is our newest program, and we provide emotional support to women and active caregivers, addressing each person's uniquely personal ovarian cancer experience. This is a quote from one of our participants in the Steps Through OC program. My OC counselor has been an amazing support in every way, providing insight, knowledge, perspective, compassion, clarity, and grounded suggestions. It came to me at the most crucial time when I felt like the initial support and care people offered during my surgery and recovery had faded away as I healed from the physical trauma, but there is still the emotional trauma that I needed understanding of and help with. And thanks to my OC counselor, I felt so validated. I am so grateful for this program. So we want to give you an overview of how we can help and how our program works. So this is an overview of the OC experience. We have what we call My OC Coordinates. It's a two-part model that we use to help address your needs. This first part is the OC Coordinates and involves 32 different topics, or your OC coordinates, and it's a collection, and we collect an initial survey of these coordinates at the beginning. At registration, 32 topics are reviewed through an initial survey of concerns. The second aspect, the second tool that we use is what we call the phase model of the OC experience, where we take a look at where you are in your ovarian cancer experience. This model is based on my observations after facilitating ovarian cancer support groups every week for 20 plus years since 1998 in Colorado as part of the Colorado Ovarian Cancer Alliance. And in those groups weekly, every week, talking with women, I started to see how this experience unfolded over time. And I could see that it was really a whole person experience. It involved body, mind, emotion, spirits, as well as social, family, everything that was part of that woman's life. And generally, what we're looking at in this phase model is from the moment of diagnosis, going through the crisis of diagnosis and the beginnings of the journey, going through coping with treatment, after treatment, going transitioning to a new normal, and then managing uncertainty. We know that that particular journey is different for every person. There are variations on this. It isn't the same for everyone. There's can be neoadjuvant chemotherapy before there is surgery, and there can be different, twists and turns with this for each individual. But what we can see in an overall picture is this trajectory of this experience, this ovarian cancer experience. What we also know is that all of these things can be happening. Issues around all these might be happening at the same time, but it's too much to take in all at once. So that's why we break it down into discrete parts so we can help take a look at each one of these. Each area requires different coping skills. The phases are experienced differently depending on the diagnosis and course of treatment. These aren't always experienced in order, and the cycle is often repeated after a recurrence. So let's just take a look at each of these phases individually, and we'll also look at the OC coordinates that go with each phase. So it's the crisis of diagnosis. We're looking at that moment when the doctor says that the person has cancer, that you have cancer. That is an impactful moment for anybody to hear that. And it's an emotionally impactful, it triggers part of our survival instincts of fight, flight, flee, freeze. And there's so many things that get triggered at that very moment. So it's understanding that there is an impact that happens there, and and we work with everyone that we talk with about how to recognize that, what the side effects, what the symptoms of that impactful diagnosis is, and then learning how to use some advocacy skills to move forward with it. The big question in this phase is, how do I begin? What do I, it's usually all new information, whole new territory of terms and everything else. So the question of how do I begin? How do I get going? Of course, there's moving into all the doctor's appointments and all the medical schedule of everything that needs to happen. But we're here to support you along that, and also then understanding that traumatic response and starting to help you learn stress reduction skills. And here are some of the 32 OC coordinates that we loosely put into this category. We can talk with you about diagnosis and surgery, what's all going on with that. Our professionals are well aware of all that. We can help you with communicating with your healthcare team. We can help with deciphering medical jargon, which is all new. What is a CA-125, et cetera. That's just really addressing that distress of diagnosis and what's going on with brain and brain activity and mind in the mind. We can start talking about the family and social relationships that are being impacted. For younger women, weighing fertility options and having that kind of conversation. We want to make sure that women of color and the LGBT community have the cultural competency there in their medical team, and what to do if there isn't that, to be able to help and coach on that. And also making sure that everyone understands palliative care and pain management can happen right away, that it isn't something that has to be held until later. So that palliative care and pain management. So then we look at the next phase, which is coping with treatment. So this is after then understanding chemo treatment and its side effects, learning ways to manage the course of treatment. This is the time when that initial crisis phase, after the surgery, after the recovery from surgery, after getting a port, after getting everything ready, and then starting in on chemo, which is this whole phase of time in and of itself, whether it's a short period or a longer period, whether Taxol is delivered weekly, or everything's every 3 weeks. However it is scheduled through the medical team, It's this period of time where a new routine needs to be set up. Everyone around, the patient is making adaptations. So for those caregivers in the call here today too, it's a time to start to readjust to a new schedule, how this is all going to be working. The big question in this phase is, what do I need to know about this ovarian cancer experience? What do I need to know about chemo? What do I need to know about side effects? What do I need to know about um, what the medical team is actually doing? Do I need to know more science? So we have this period of time here that we can support you in understanding the anxiety of the treatment process, how that's all going, scan anxiety, etc., and then learning, helping you learn some coping skills for this period of time. The 32 coordinates that go along with this are, if you need home-based support, we can be talking about that. If you have to travel to treatment, we understand that we have resources that can help with lodging and with travel, even airplanes, free airplane rides that can take you to a location if needed. This is where we can also start talking about financial concerns with having to maybe be off work because of going through treatment. We can look at treatment options. We can help you connect with a scientific team to talk about clinical trials or things that you may also want to include in that first line of treatment. We can talk about managing just the whole chemotherapy experience and different ways to manage side effects. I'm looking at coping and resilience, looking at body image, because we know the hair falls out with Taxol, and there's this whole beginning change of like, who am I? What do I look like now? And then how to gain connections and support, who to reach out to, who can be there to manage that experience. So then we move into the transitioning to a new normal. Now, generally we tend to think of things that there's an ending and there's a beginning. And so often I think, we think, okay, chemo is done, I'm over it, carrying on with life as it was before. However, this was a big experience. The first two phases are very impactful for most people. And I think most women don't feel quite the same. And so while there may be this hope that you're just going to be moving on and everything will be happy, it also often is a time when there's some emotional processing that needs to take place, that you may not feel quite as happy as you thought you might feel when it's over. And largely that's because going through it physically with all of the physical challenges of the surgery and the chemo, there's just not enough bandwidth energetically to do a lot of emotional processing during that time. So it all sort of catches up at the moment of the end of chemo. And of course, as we know, some of you, see that you might have to jump back into some other treatment right away, other things that might be happening at that point. So we understand those challenges at the end of chemo and about, helping about learning skills for adapting to change. The big question here is, who am I now? And I think another key piece in this part of the phase is that the caregivers again who are on this call, you didn't have to go through the physical medical aspects of this. You had probably more energy and bandwidth available to start the emotional processing. So that might have started earlier on for caregivers, and they might be sort of beyond, moved on around faster than the patient survivor herself. So you might kind of be on different wavelengths at this point. And so this transitioning to new normal is really an important time to really take some time to recognize some of the losses that have occurred, maybe there's a change of identity, or maybe friendships have changed, but there can be some losses. So it's that time to take times to emotionally process, and then we can help with learning some new emotional processing skills for this period of time. So in this transitioning to new normal, we're looking at, okay, then who am I? Am I different for having had this cancer experience? So this whole idea of my identity, that is something that's very real that we talk with women about all the time, and caregivers as well. And as a patient, survivor, person, like who am I now? How have I changed? And then I think there's those questions of, what do I need to change my lifestyle or my routines, and what can I do to gain some control possibly over the situation. So there's often taking a look at food and nutrition, at looking at energy levels and exercise, looking at fatigue and sleep, which probably was already addressed in the earlier two phases, since the fatigue can really be part of the chemo experience. But maybe really looking at complementary therapies and saying, what do I want to bring in to my life? Looking at sexuality after going through such a big experience, bringing that back in, making sure that that's really an important part of relationship with spousal relationship, and then looking at post-treatment health management and just generally managing transitions, which I think none of us have gotten the big course on how do we manage these big transitions in our lives, and having this cancer experience is certainly that. So that moves us into the fourth phase, which is managing uncertainty. This is the understanding the ongoing challenges of uncertainty and learning skills for discovering meaning. Because the big question in this phase of the experience is, how do I want to go forward and live my life? What is most valuable to me? Who and what do I who do I love? What do I love the most? How do I want to live my life? How do I want to live a full life, even in the midst of this experience? Because the fear of recurrence is there within this ovarian cancer experience, and that fear of recurrence can like completely fill up one's sense of foreboding and create a whole lot of anxiety. And it's really not a full life if 90% of one's consciousness every day is filled up with this fear. So we really help talk with women and caregivers as well about how to move that anxiety level down. Probably never goes away 100%, but at least it can be at 10% or below, so that it isn't a life filled with anxiety, but it's a life filled with purpose and meaning. And how do I want to live my life? So with that, we're looking at understanding values-based living, talking about that, and learning some mindfulness skills to watch what's going on in the mind at any given time. The OC coordinates that generally go along in this phase is looking at that recurrence fear, how to manage fear, and then how to detect and manage, how to detect recurrence, making sure that someone is on a good follow-up plan with their medical team, so that they're being checked every 3, 6 months, 9 months, a year, wherever they are in that process. Just making sure that that is really something that's in place. Looking at that emotional impact of a recurrence if it does happen. We certainly talk to a lot of women in recurrence who say that second diagnosis was even more impactful than the first one. So looking again at that trauma of recurrence or trauma of diagnosis, and then looking at, well, okay, what are the advanced choices that are available here? Our scientific team is amazing at being able to talk about that, and looking at what are the choices between standards of care and clinical trials, and what's the plan for going forward and managing that recurrence. And in that, in the fear, in all of that is that fear of mortality, that sense of that brush with mortality, that kind of can be a thread that runs through it, and that can be a core anxiety that is sitting there all the time. So we really encourage everyone to get some of the paperwork on some of these details in order, get advanced directives in order, anything that needs to go on around any sort of end of life conversation, get all of that done, get that written down, get that put on the shelf, so that there is that opportunity to continue to live every day and enjoy every moment of every day, and not be thinking about what's my end of life going to be, just think about what's my day going to be, how do I live my day. And then we know that, we have participants in our program who are approaching end of life, and we talk with them and we help them and help get connected to hospice and help keep that quality, so that there is a good end of life. I know that may sound like a oxymoron, but there is, with planning, there can be peace and care and love. That care is a thread that goes through that part. So of course, in all of that, there can be conversations about spirituality and what do I really believe and where is my faith, and then looking at long-term survival. Again, we can say that long-term survival is just, is where we all want to get to. However, if that survival is fraught with so much anxiety about end of life, then we need to look at that and how to bring that care and that understanding of and that anxiety back down so that life can be lived on its fullest terms. So this is our two part model that we use. We have the 32, you can see the 32 coordinates that go around the circle, and then each of the 4 phases. And this is what we talk with you. We talk about all of these different things, all of these aspects of the ovarian cancer experience as we connect with you in our program. And another quote here from one of our participants: "This program is a gift to all ovarian cancer patients. The OC counselors here are specifically knowledgeable about all the baggage an ovarian cancer diagnosis carries. This program has given me hope in managing the physical, mental, spiritual, and sexual challenges that I've wrestled with as an ovarian cancer survivor of 8 years. Everything is confidential. I wish I had participated in this program sooner. The load feels much lighter." So now we're going to take a look at how it works step by step. The Steps Through OC program then is made up of 10 one-hour visits with an OC counselor, which we'll talk about a little bit more here next, over 6 months. So you have a potential 10 hours of time to talk with an expert who is well versed in this ovarian cancer experience. The OC counselors are experts in the Steps OC program, are master's level mental health professionals, and they're located all across the United States. We have 11 different OC counselors right now on our team. The meetings are by telephone or video conference, so it's all virtual. We were virtual before COVID, and we remain virtual so that we can talk with everybody anywhere where they're located. The program is for patients or survivors, whichever way you want to self-identify, and for active caregivers. So we assign, or the patient survivor gets her own OC counselor, and if the caregiver and the family member is interested, he or she can gets her own, his or her own OC counselor. The reason we say active caregivers is that it needs to be within the process of currently what's going on. We don't really have the bandwidth to help if somebody's 20 years out from a diagnosis, and a caregiver is seeking support at that point in time. But mostly it's just in the current scenario. And it's important for us to clarify that we are providing OC, ovarian cancer support services. We're not providing in-depth mental health psychotherapy. I know that sometimes people call us a therapist, but we specifically say we're OC counselors because we know about ovarian cancer and we're supporting through that experience. But we also know that those traumatic experiences from childhood, etc., can also be really triggered during the traumatic impact of a cancer diagnosis. So we really do help people then connect them with other resources, other mental health resources as needed in terms of some deeper mental health therapy, psychotherapy. But through our 10 sessions, we're looking at what we were just talking about, all those different ways of approaching the OC experience. And it's very important to know that there is no charge. We are a nonprofit. This is what we're doing. We're providing these services to you at no charge. And we always appreciate any donations that come in for us, but it's not for any charge to you. So when we start the program, there's an orientation, and then it's followed by the 10 sessions. Even though I was talking about the phase model and the OC coordinates, the conversation is really participant driven. So in the orientation, we have to go through a couple of key points, make sure that some housekeeping items, et cetera, are covered. But in sessions 1 through 10, it's not manualized. You don't have to follow anything in particular order. You come to the session, to that meeting, that visit, with what's on your mind and what's going on for you right then and there. We have that 1 hour conversation with you. During that, we can figure out if you need additional educational materials. We have a content library that is matched to those 32 points, so we can send out educational materials to you around any of those topics. And then we have referrals to external resources if needed. We can give you referrals to various different other organizations, and again to mental health, psychotherapy if that's needed. And this is just a chart to show essentially how we work with the 10 sessions over 6 months. What we have found is that the best trajectory for these meetings is to meet with you weekly, once a week for the first 4 weeks for the first month, and then to meet with you every other week for the second month, and then to meet with you once a month for the last 4 months of the 6 month trajectory. And then after someone goes through all 10 sessions in our program, we have what we call a grad group for survivors, patients, and a separate grad group for caregivers. So we can continue to stay in touch with you through the grad group. So this is how you can participate in the program. The first thing is to get registered, and the best way to register is online. The information is there on the left. You can register directly at the stepsthrough.org site or through the psychosocial support tab on the clarity.org site. You can also give us a call at 866-830-5134, and we can talk with you and answer your questions before you register, or you can also email stepsinfo@clarity.org to get in touch with us to ask questions. So there's this online registration, and in that registration is where we ask the 32-point OC coordinate survey, as I was mentioning earlier. And then once that registration comes in, then we look at the availability of all of our OC counselors, and we also look at the region and area that people are located in, and we assign you to one of our counselors. And all of our counselors are amazing. They're just amazing practitioners. So we trust every single one of them to take care of you at the very best way that they can. And what they will do then is they reach out to you directly to set up that initial orientation so that you're ready to meet for that orientation time. And the assessments, we have 3 sets of assessments. If we can go back to that, back one more slide. There we go. That at the assessments, we do like to give an assessment. We have 3 assessments that we give. We like to give them at the beginning and the end. And this is a way for us to keep track and measure if we're having actually any effect or any actual outcomes with what we're doing. We have 3 measures. One's a stress measure, one's a coping measure, and one's a quality of life measure. And these are delivered at the point of the orientation. So we like everybody to fill those out. And then with education and resources, again, we have the content library of the 32 points, information about all of those topics. We have the phase model. We have 2 specialty consultants that we work with, an oncology dietitian and an oncology chaplain that we can refer to for 1 or 2 sessions with them. And then we also understand that the ovarian cancer experience, it may not be tidily put into 10 sessions. So if someone has has recurrence or has experienced another traumatic impact, we can go ahead and do a few extended sessions on an as-needed basis. Of course, we're looking at a lot of people coming in for a long time, so we keep those segmented and on an as-needed basis. But just so you know that that is available. And we did do a pilot study of this program from 2019 to 2020. And it was the study was based on the assessments that I was just mentioning, and the evaluation was done by San Diego State University of the results of the initial. At that time, we also had midterm and final data that was collected through those assessments, de-identified. It doesn't have anyone's name with it. And what we found was that the program showed statistically significant improvements. in coping, stress, emotional well-being, and quality of life. That the denial was reduced, self-blame was decreased, overall perceived stress was lessened, acceptance was increased, use of external or instrumental support was increased, positive reframing was increased, overall social, emotional, and functional well-being was improved, and overall quality of life was improved. So we're very happy to know that we've got some actual data that shows that what we're doing is helpful. And in this last quote, one of our wonderful participants said, "The program provided knowledge, familiarity, experience, and much understanding of the ovarian cancer experience to this woman who never, ever, ever, ever dreamed she would have cancer in her life. You helped me to become informed and to find ways to choose to go forward in life instead of throwing in the towel. You helped me to know how to talk with medical folks, what treatments and questions I should include." So now I would like to introduce my colleague Janice Hansen, an OC counselor and our lead outreach coordinator, to answer any questions that you have submitted. Hi, Janice.
Hi.
And do you have some questions from any participants in the program today?
At this point, we don't have any posted, so I encourage those who are in attendance to please go ahead and post your question in the Q&A box. In the meantime, I have a couple of things that I know that people have asked me along the way that maybe you'll be able to answer as we're waiting for other questions as well. One of them is, how does this program complement any support services that a patient or a family member might already have available to them from their cancer center?
Yes, that's a good question. I think the difference with the Steps OC program is that we have 10 these 10 one-hour sessions that are extended over this course of 6 months. And that while that it's really wonderful if those services are also offered in a cancer center. But from our experience, we know that social workers in the cancer center are often very busy and may not have time to meet with someone that frequently. So we are just dedicating our time to these long-term relationships and this longer term, these more hours that we can spend with people.
Yes, and what I've experienced too is that it's a nice compliment that I know the OC counselors often ask if they have a support service available through their cancer center so they can connect with them, and we help them know that they're available too.
Yeah, I mean, we want to get the whole team, right? We want to help everyone build a team. We're part of the team. Their cancer center is part of the team. Maybe there's their oncologist is part of the team. If they have a medical oncologist, a gyne-oncologist. Of course, we want everyone to be with a gyne-oncologist as standard of care. And then if there's other complementary therapies or massage or whatever. So we really encourage, yes, it's really best to build a team.
Yes, absolutely. And, the other question that has often come up is, how is the Steps Through OC program different from other online or virtual support programs that are out there that people might find when they're doing their search online?
Well, I know that, there's other mental health, online mental health platforms like Talkspace or BetterHelp and those, but they're not specifically trained in cancer support and definitely not trained in ovarian cancer support. So the terms of, carbotaxol and CA-125s and all of the language that goes along and all of that part of the experience, most regular mental health providers are not trained in. So while we might refer out to that if we feel like somebody needs some additional mental health support, I don't know that they're prepared to have the kind of conversations that we have. And what are your experiences as an OC counselor, Janice, in that arena?
Well, I know that there are other OC platforms in terms of offering cancer support for women with ovarian cancer online and virtually. And I think what's really standing out about this Steps Through OC program is that it's personalized one-to-one support versus online chats or blogs, as well as groups. So I think we're unique in that quality. And also we work wonderfully with people who are still part of those groups that are focused on ovarian cancer support. So it's really, again, a nice complement. One of the other questions that often comes up for folks is how flexible is that 10-session schedule in terms of if participants are still working while they're in treatment or their caregivers are working, how accessible are the OC counselors when people have schedules that may not be as flexible?
Yeah, good question. We have found just initially that this trajectory that we've outlined is really good in terms of making a strong connection with the counselor at first through those weekly meetings and then moving into less frequent. But we also know that medical appointments come up or emergencies come up or work comes in the way if someone's still working. So our each OC counselor is willing to work with every individual to make sure that there's that time and to schedule the sessions at times that are workable for the individual.
Mm-hmm. Yes, and I know that as an OC counselor, we're often having those conversations about what is the best fit. And as far as timing, I also know there's some flexibility in the timing of those 10 sessions so that it's not set in stone in terms of what we've laid out as a template. So that's really nice and helpful for our participants to know as well.
Yes, yes. So anything else? Any other questions that have come through?
No, not at this time. Is there anything else that you think would be really important to add?
I think I think we're good for now, and I encourage anybody that does have questions. We'll be putting up the slide next on how to contact us, and so please feel free to reach out to contact us by email, by phone, or to go ahead and register for the program, and we'll answer your questions first, or you can just go straight into the registration. So thank you so much for joining us today. We are here for you, and please feel free to reach out. Thank you.